sir. Thank you, sir. Thank you.
Pleasure to see you as well. Yeah.
Okay, good evening. Good evening, everybody in India. Good morning in North America, and good afternoon in Europe and other parts of the world. It's such a pleasure and indeed a privilege today to have two of my teachers, very honored teachers, teachers of teachers, two very distinguished gentlemen as mentors today. And of course, they don't need any introduction, but as is the formality, I will just introduce very, very shortly, because you start introducing them, we will have the whole hour introducing them. So I won't do that. Professor Majid Sami, if you don't know him, of course, you will not be a neurosurgeon, neither a student or a neurosurgeon, neither in training nor a faculty. So Professor Sami is currently the president of INI Hanover and also president INI China, two INIs in China. And he is, of course, honorary president of WFNS. And he has, as I said, I don't want to go on to introduce him. It's just not necessary. And I can't finish it in 1 hour. You all know him. He doesn't need any more introduction. And the other gentleman, my teacher, under whom I trained my first training in neurosurgery, Professor Ajit Banerjee, again, doesn't need introduction in India, any part of Asia, they all know him. He is the emeritus professor of neurosurgery, All India Institute of Medical Sciences in New Delhi, who's one of the prime member who has facilitated the development of neurosurgery in India and in South Asia. He is the founder of another neurosurgery unit in New Delhi. It's called VIMANS. He's also the emeritus consultant in Apollo Hospital, New Delhi. But most importantly, he has taught many of us how to lead a life of a neurosurgeon, not only neurosurgery, but how to deal with patients and how to live a life of a neurosurgeon. So it is just a great privilege for me to introduce these two mentors. And these mentors will be interacted by, again, two dear friends, Professor Miroslav Vukic from Croatia. He is the president of Croatian Neurosurgical Society and the professor of neurosurgery, Medical School, University of Zagreb, Croatia. He is currently the assistant secretary of WFNS and the board member of Audit and Governance, European Association of Neurosurgical Societies. And my very close friend, Professor Suresh Nair, again, who doesn't need an introduction to this audience here. He has been the president of Neurological Society of India. He is the president-elect of International Meningioma Society. He is the secretary of the World Federation of Skull-Based Surgery Societies. He is, as many of you know, the former professor and chairman of Neurosurgery Department and Dean at Sri Chitra Thirunal Institute of National Importance. And he was also the former professor of neurosurgery at All India Institute of Medical Sciences, Bhopal. So without further delay, let me start the question to Professor Sami, and then Miro will take over. Professor Sami, many of us have learned, live our life, do our neurosurgery as you have taught us. But probably, at least the younger generation, and many of us would not know about your life other than neurosurgery, because everybody knows about as a neurosurgeon. We would like to know a little bit about other than neurosurgery and your contribution, not only doing neurosurgery, but promoting and educating neurosurgeons all over the world. Let me start with asking you your contribution to American neurosurgery. Let me start, which is not very well known.
Yes, of course. As you know, as I started 1966 with macrosurgery, and I tried to do in laboratory anastomosis of 1 millimeter vessels together. I was very proud that it had a good pathway and is functioning. And more, I have seen many possibilities for peripheral nerves under the microscope and in connection with nerve grafting. And so that my really first attempt was scientifically to discovered the entire peripheral nerve regeneration system and pathophysiology and all damages on then suddenly I found also the tumors and and brachial plexus and that was fascinating for me. And I have started to use nerve grafting in all human body where never ever somebody has done. And I had done a wonderful collection of all approaches to peripheral nerve brachial plexus. And so that was already in the 60s, you know. And in this time, of course, I was in the hospital using the microscope for aneurysm, for all type of neurosurgery in department. But my first strong approach was the peripheral nerve. And so I had a lot of visitors from United States. I remember in one of my first courses, I think more than 60 American students came, or just young neurosurgeon came and learning then the microsurgery under the microscope. I had a bit company size, a huge space at the University of Mainz, and they came and then we started to educate how to work, how make the suture with 10 threads that you cannot see with your eye, only under microscope, then you can do it, how to do it. So that was the reason that in 1973, the Dr. Scoville, he was at that time the educators for all America, because he made courses, very huge courses in Maine. And then he has all the top American teachers in his courses, but he has always invited one international guest of honor to come and bring something new when they had something. I remember in 1 year was Dr. Yajargil, and one next year I was invited by him, and in Maine, and at that time, all the teacher of the 70s in America, they were all there, and I know because I had so many things in the microsurgery developed. I gave, I think, at least eight lectures, and these lectures, of course, has enormously influenced 1973, that the young American neurosurgeon, when they made the board of neurosurgery, then immediately they came and spent 6 months or 1 year in my department, so that many Americans, that was the first ever group who came to me to be a joint. Then, of course, Dr. Don Becker in Los Angeles asked me, came to Hanover, said, Professor Sami, please, could you please introduce the skull-based surgery to the American colleagues? And of course, in the 80s was Dr. Sheikha in my school and many others. And Sheikha was the most active of them, that as he was spent his time in my department, he went back and I advised him what to do, create a skull-based society, and so that he followed all my advice to do that. And that was, of course, I cannot remember all the names that have been with me. That is my problem. But very important was the education which I have started in Los Angeles, because I organized at least 3 or 4 courses with live surgeries. You can imagine at that time to operate huge craniopharyngioma completely and demonstrated by by videos to the auditorium, and so that I had a great number of fans, and therefore in that time I became honorary member of all American societies, because the professor has all suggested. And finally, I think I have received from them the highest honor, that was the Golden Medal of Honor of the American Society for Neurosurgery, which was never ever given to any other nationality than America. I was really very touched about the reaction of my colleagues, and so that and that was the first, I would say, countries that started to also support my personal activities and personal, I would say, educational program. And I have unfortunately lost so nice friends like Peter Janetta. You know, then I organized in 1980 the greatest Congress on cranial nerves. This is the first meeting ever about cranial nerves, which 81 was published that, you know, this book. And this book is still, if somebody read this book, you see, everything is fantastic about each cranial nerve, what you can do, how you can preserve, how you can reconstruct, and so on. So the Professor Malis was really a fantastic, I must say, for me, he was one of the best macro surgeon in my time as we started. I remember I was visiting professor, of course, in many American universities, and Professor Malis, once I was in Mount Sinai Hospital in New York. And as I gave the lecture on acoustic neurinoma, and he went to the macro said, "Dear Professor Sami, I think we could change our carousel. So what you have demonstrated, I have similar slides collected from." He was one of the best American, I would say, neurosurgeon in the history. And he was a very calm person, a very really distinguished person, was one of my best friends. And the same is also Dr. Rotten, you know, was also, I wrote also in a preface for his book on things, and he was also a real educator. And they are people that I put in my heart because they were looking for the truth. They were looking for development. They had not any other ear. They were just hardworking. And also, I must say, at that time, a person who was very behind me and support was Dr. Ranzau, John Ranzau. I don't know if you know.
Yeah, we know him.
In New York. And he published one of the most important American book in 70s. And he asked me to write, I wrote a very large article, also a chapter for management of modern macrosurgical management of peripheral nerve system, you know. So this is a short, I would say, I can talk a lot about that.
Miro, why don't you ask Professor Sami about something about his life?
Yes, I will. I'm very glad to do so. Professor Sami, thank you so much for being my partner in that interview. We personally met first time in 1997 when I, for the first time, visited one of your courses, and late Fred Epstein was there, Shaker was there, Spetzler, I guess, many great names in neurosurgery. But let's go back to your youth. And I will, let's say, I will behave like, right now like a journalist. So, Professor Sami, is it true that when you went for Germany from Iran, that you were studied at the same time medicine and biology and zoology? Is that true?
Yes, exactly. How do you know that? Yes.
So I was, you know, I prepared myself for this interview because parallelly, yeah. That's, I want people to understand how it's difficult to, you know, I'm a child of, let's say my father was working for 29 years in Germany. So I like Germany personally very much, and I know how it's difficult to get to the success there, in particular, not speaking German language at the beginning. But there is my second question, again, please answer. Is it true that you were declared as the best Iranian student in abroad ever.
My goodness, how do you know that? I have never talked about that, because it is, I personally don't like to talk about my merits and whatever I have received, because the other people, they say, okay, they can say that, but you are absolutely right. As I made my final examination in Germany, my mark, which I have received, and by the way, normally at that time was about 6 years, the education in medicine in Germany, but I did it in 5 years, you know,
Yeah.
and then there was an organization at the Shah time in Iran, that they evaluated in Europe all Iranians who have finished their studies, in which level they have studied, and compared that. And this commission has found that I did the best exam at that time. And there was, at that time, that was, it is a royal award, which I have received, that was 5,000 D-mark at that time. I have the documents of this, and the ambassador called me and said me that I have been also asked to inform you, and we want like to make a ceremony to give you this award. And so, how do you know that? Because it is not in my
it's not worldwide known, but I wanted everybody to know, and I wanted you to say how difficult, how hard worker you were at the beginning. So nothing comes easy.
No.
Success is not a, overnight process. And I'm just telling you, as your former student and pupil, how deeply I respect whatever you did, especially in young age and at the beginning. Before you moved from Mainz to Hanover,
yes,
was it true that you were also offered a leadership position in the neurosurgical department in Leiden?
Oh, yes.
In Netherlands.
Yeah, the reason for that was, one of the former president of WFNS, that was Professor, help me, from Leiden. He of course, were observing me all over the world. He was president of WFNS, and as he was getting retired, then he has proposed to the medical faculty in Leiden, please ask Professor Sami to become my successor in Leiden. Leiden is a very interesting city of Holland, and I said, okay, and the dean of the faculty has written me, we would like to offer you the position of the chair of neurosurgery here. Please, I say, okay. And I made an appointment. I went there for a couple of days, and I was impressed. By the way, you should know, the best anatomical institute
is there. Yeah.
Is in Leiden. Nothing better than in all Europe. I was so impressed to visit this anatomical institute, and and of course I discussed with all the professors, and I saw the department, and I have tried to study the rules of the medicine in Leiden, and finally I came to the I would say conclusion that there is a big difference between Germany and Netherlands, so that I cannot move to Germany to go down to say. But it was a great honor, to be asked to become this position there.
Professor Sami, I have two more very simple questions. First one would be, what would you change in neurosurgical education if you had a chance to, in simple words, what, looking back, you know, from 40, 50 years,
yeah, but you know,
let's say distance,
really,
what is better now? What was better then?
This is, I must, Dr. Wagner, I can tell you, this is the most important question which existing in my life.
In your life.
I thank you that you asked me this question. The problem of education is that we are talking because we have started with all these educational courses, and so by myself, of course, my educational course is completely different than all other educational courses existing in the world. Why? I said, this is not a political assembly education. Education is really to transfer the knowledge in details to the others. I was fighting many times with all chairmen of the later chairman of education committees. I said, come on, this is not acceptable to make a course and invite 20 people to come and then give lecture. This is not education. This is a meeting. Everybody 10 minutes, 10 minutes, and 10 minutes that everybody say, I am teaching, making education program. No, the people will not have benefit of it. I know that. Education is when you bring a topic and give enough space for discussion, to go into the details, to explain all the thesis, complication, everything, but that the student come through the top. And this is, I would say, this idea I had all the time, and therefore my courses was so, I never stopped at the speakers in my educational courses. Never, ever. When I saw that he's giving fantastic information, I said, let him do it. And when he was finished, I never stopped the discussions to look that the next one has to start. No, I said, this topic is so important. People are interested, a student are asking, and the teacher is giving fantastic answer. This is the real education. And therefore, I hope that the people will avoid in future to name these all educational course. We do an educational course in Brazil and so, and 20, 30 people invited and come, everybody give 10 minutes and then one question, and then that is not education. This is a congress, this is a meeting. Yeah. And I am happy that you asked me this question. And therefore, I have been very successful with my education, what I have done around the world. And I remember, I have to tell you once, we were in Gurumqi in China. We had an educational program from Gurumqi. And I started, and it was invited so many people. They gave lectures about a statistic, what written in any books, you can read it. And I came and I started to talk, and I should talk about 20 minutes or so. When 20 minutes was the end, and I had to say so many important things, I was stopped by the chairman of the session. And of course, I stopped and I went back and said, I will never give any talk because I know these people. What happened? All the students at that time, they said, we don't want to hear to anybody else. Please ask Professor Sami to talk 2 hours for us. I never forget that. They had a meeting together and asked me, please come and give 2 hours lecture with Hans Lerner. This is really something that we have to change also in our now educational program, in every committees, everything. They should stop, invite more than 4 teachers for the whole days educational program and not to take. Thank you for this question, because this is in my heart. It is killing me all the time when I read the educational program in any places. Thank you very much. You put your finger into the wound of the World Federation.
And, you know, as being your listener for many years and attended over 50 of your talks, that was, you know, a question that came immediately. It's so natural because I was listening to you for 45 minutes, 1 hour once. And you know, I thank you for each of your talk, and thank you for being in Croatia several times. And my final question for you,
yes,
it's a little bit, forgive me, personal.
yes,
but tell us, Professor Sami, you're over 80. What is your driving force? How can you manage whatever you do on a daily basis? Tell us the truth. Tell us the trick.
Oh, that is another important question, because my dear Miroslav, I must tell you, the age is a number.
Yeah.
Nothing else than the number. Some people in the age of 50, they are already tired and are not anymore happy to work. This is a completely different story.
Yeah.
The drive I had in my life was, you must imagine, as I started with neurosurgery, neurosurgery was a disaster. So many people died of the surgeries. Every surgery was with complications. And from that time until today, when I tell you, I wished I could show you, alone in the last months, I have done 2 surgeries, which has never ever done by any neurosurgeons, which I have developed in my brain to solve the problem, because the problem could not solve in a very large country. And all neurosurgeons asked me, can you hear? I thought, and then I found a way to. This is the most important, I would say, drive that gives me more and more energy, that say, okay, I have a wonderful overview about all problems of neurosurgery. And for me, it's much easier to find a solution for those parts which still is not solved. And I think this makes me happy, because of course, still I like to operate an acoustic door, you know, I have developed for the whole world how to do it, but still I enjoy to do it. But I enjoy more when I receive a case that I know there is no solution, and I can work on that and think about. Believe me, sometimes the whole night I cannot sleep, because I am thinking about this case, how I can next day try to give us suggestions. And this is joining me all the time. The other point is the physical condition. If you don't have the physical condition perfectly, and last but not least, my dear Miroslav, is the mental condition. The mental condition is something I advise to young people, please, never carry with you a problem permanently, because the problem destroyed the association of your brain cells. It is like an epileptic seizure. They are always that. When you solve the problem, put to the side, your brain is open and absolutely free of problems, and then you can work very well. And to young people, I have always said, never put a poison in your body with many, I would say, bad things of the life. They will jaunt you until the last day of your life. And therefore, I am so happy about that I try, if something happened, I try 5 minutes to solve it, put it to the side, and then start again to work for that, what I can be really, I can help the other people.
Thank you so much, Professor.
Miro, I have a couple of things to ask Professor Sami before we end it. Thank you, Miro. Thank you for doing it very well. And thank you, Professor Sami. And to know that after 50 years, you have still a sleepless night for a case. I mean, that is something I think every one of us should understand, remember, and we have gone through that because we all trained. I spent time with you in 1993. And I just like to tell the audience here, some young neurosurgeon. I was a very young neurosurgeon that time, of course, a very unknown entity, and Professor Sami was Professor Sami. You know, he was known all over the world. And I had written to him that I would like to come and spend some time with him. He, of course, agreed very kindly. And the surprise of surprise, the day I reached there, Professor Sami was there on the lobby receiving me. Can you believe it? Can you believe it? I was a young neurosurgeon, and which hundreds of them would be going to his department, I'm sure, every year. And he was there. I was so pleasantly surprised. So that is Professor Sami's human relations. He treats everyone equally. And thank you very much, Professor, for that. It has been an honor and privilege. We still follow every time, like Miro said, we listen to a lecture of 30 minutes, 45 minutes, 1 hour. We want to hear more because we get, even today, the last lecture, I told you that, last lecture I hear from you, I get some points. And of course, at a stage when you have operated many cases, you know which one to change to make it better. So that has really helped and still helping. Before I end, I would like to ask your contribution to Russian neurosurgery. I started with American neurosurgery and finished with Russian neurosurgery. And I know, of course, that you have had the highest of honors in Russia. Would you like to tell a little bit before we ask get some questions from the audience?
First of all, I would say, my dear Vasant, you are one of my first, I would say, students, because you have this document that you were assisting me in 1981 by a very complex brachial plexus. But you remember at that time, we had a glass chapel in the institute. Yes. And suddenly I was looking up. I have seen can you remember what I have seen watching us, you and me? We had some
monkeys.
This is such a nice memory. Mirasal, you cannot imagine.
I didn't want to tell that.
Monkeys were watching us doing surgery in 1981. And yes, and therefore, my dear, you are always in my heart, Baston, and you have never stopped to learn and learn. I told you recently, any time in the last, I would say 40 years, or I have heard your lectures. I have seen, of course, in the beginning, I was not so very satisfied because it was good, but not very good. But I have seen that permanently your lecture improving, adding new knowledge, new, I would say, activity of you. And therefore, this is, I think, Miro, this is also belongs to education. That's to permanently, you improve yourself in selecting the cases or approaching the cases when you get better results. And your question, my dear Basant, about Russian, I must say, first of all, I must tell you, as we had the iron wall in Europe, this is important for you, Miro. Iron wall means at that time, we had two different worlds in Europe. A world as a second, third grade, on the right side and West Europe as very advanced and so. And at that time, what made me very angry was that my colleagues in the West Europe didn't recognize my colleagues from East Europe, also including, I would say, when we far away, Russian as well. And I must say, I was one of the really person who traveled to East Europe permanently. Perhaps you remember, Mr. in your time, that I was in many congresses, and I have organized 3 courses in Ljubljana at the time that Dolenj was studying by me to learn microsurgery.
I know
and
that.
3 courses. This is something we cannot ignore. That was, I brought so many microscopes to Ljubljana. It was in 76, 78, and I think 74, 76, 78. Every 2 years I did a course there. But the question of Boston was, I was, for example, in Sarajevo in 79, in Sarajevo for the first time to give the lecture in Sarajevo. In Belgrade, I must say I have been in the last 50 years also. I've been in Belgrade giving lecture there, and I was by any ceremony of 30 years, 50 years, and so ceremony of the Belgrade Institute, I was there. But my strong relationship to Russia was, the reason was Alexander Konovalov. Alexander Konovalov was one of those neurosurgeons who started almost in the same time as I started with the microsurgery. And we met each other in 1971 in a meeting when it was an international microsurgical meeting in Frankfurt, I think it was. And we met each other, we become good friends. And from that time, he sent then his people from Moscow to me, to Germany, stayed a couple of months, perhaps 1 year. And so almost all his staff from one of the other, they came. And then, of course, we have started to organize courses, meetings, and I was every year at least 1, 2, 3 times in Moscow. And the Konovalov was taking care of all, at that time, Soviet Union's countries. They came all to Moscow who spoke the Russian. And therefore, I had a fantastic connection with these meetings in Moscow with all the countries in that Soviet Union, the former Soviet Union. And that was the reason that we had a fantastic, and then we have created the telecommunication, which I, between the Moscow and Hanover, so that I could also give lectures to any meeting there. And Konovalov was really a fantastic also teacher, one of the best neurosurgeons in our time, I must say. I had great respect to him, and the same to him, he to me, and so that I become all honor of the Russian society. First of all, of course, I've become member of the Russian Society of Neurosurgery. Then 15 years ago, the National Academy of Science made me as honorary member of the Russian Society of the Russian National Society of Academy of Rational Sciences, and then the Borbenko Institute has planted a tree after my name and said that this should remain forever, that the people, and with a plaque. The last thing what they have done, which is the highest honor that Russian can, the the National Academy of Sciences can give to somebody, that's Pirogov Gold Medal. Pirogov Gold Medal. Do you know Miro, the Pirogov Gold Medal? No. You can read it. This is from 1811. He was the neurosurgeon. There was a surgeon that organized in entire former Soviet Union many innovations of how to treat the people in the war, and therefore in many former Soviet Union countries there are hospitals after him. Also,
yeah, I heard, but I never knew who was the person.
They have created, the National Academy of Science created a gold medal of Pirogov, and they give several years once to a person internationally or nationally, but it is not a gold medal that every year is giving. So they made a big ceremony, and I had to go to the National Academy, and they have delivered to me. Anyway, I must say my relationship to Russia is, and next month is the 100 years Burtenko Institute ceremony, anniversary, and Alexander Konovalov asked me, I want to have one guest of honor to come and give a lecture for the 100 years. If the pandemic allows, I will go, because I don't want to disappoint my friend Alexander. So this is a short memory of the Russian. Of course,
I wish we could continue, but unfortunately, I think every good thing has to end. But before I do that, there is some comment and questions. There is a gentleman who has asked, which may not be very common for you, but he says, hello, professor, how you used to handle the poor results following surgery? How you tell the relatives, and how do you explain to the relatives the poor results? As I said, it may not be very common occurrence with you, but this is the question. But poor results, how do you explain the relatives if there is a poor result?
Bad outcome.
Complication. If you have a complication, if you have a complication, bad outcome, how do you explain to the relatives?
A complication.
If you have a complication, how do you explain to the relatives?
No, look, the situation is as follows. If is a complication, for example, if a patient has a fistula, a leak, I go to him immediately. I say, look, this surgery is like this, and you have to close the dura, but it is from 10 patients for 20 patients. It's possible that for the sutures, at one places when you sutured, it is not tight enough, but during surgery, you believe it is tight. But later, when the pressure in the brain increase, then come out. And this is not so difficult. We have not to close it. And don't worry. This is not, of course, the patient is not very, very happy to hear that, but you can't help. Or a patient has been operated in the acoustic neurinoma. And of course, I prepare the patient before surgery, but he has, for example, weakness or the paralysis of the face. I say, go to him. I say, look, you have it, but I have preserved the facial nerve. It takes a couple of weeks or a couple of days, and it comes back. Or the patient had a bleeding. This is probably one of the things that's very frequently happened in the world. Then you can say, look, this is something we have also explained before surgery. Unfortunately, you have some bleeding, but we have to remove it as quickly as possible. Then you can be safe, and this is not. The most important is honesty to the patient. So never, ever we should try to ignore the truth to the patients, because this has later very big complication. It's more complicated than when you don't do it. Because if later the patient says, why? He's not telling me what is going on. And therefore, don't worry. It is perhaps a shock for the patient to explain and so, but it is better you do it and it's clear and you have no problem in future. Otherwise, it's a big problem. Yeah.
So honesty and truth always wins, rather than trying to hide something. I think that's the lesson we learn. And all of us go through some complications, but better to come out and tell exactly what has happened and what is the best solution.
My experience is that the patient mostly understand it. There are perhaps 1% or 2%, they are crazy, but that's existing in everywhere in the world.
I think go ahead, Miro, go ahead.
For ages, honesty has been the best policy, right?
Yeah, absolutely. You know, that is, and also in education, you know, that is also honesty. I have always in my lectures said, the mentor, your teacher, is educators. He is the person that the student has a reflection of this, of his behavior. Look, many students later behave themselves like the teacher.
Absolutely.
Absolutely. And you can see the character of the people, you know.
Yeah, in particular in surgery or in neurosurgery as well.
Yes,
very true.
Very often.
And therefore, I remember that my teacher, Professor Schumann, who was not in the era of microsurgery, because I have started microsurgery. He was the pupil of Tönnies, the famous Tönnies, who was the founder of neurosurgery in Germany. And he said always to me, my dear Dr. Sami, every evening I want to look into my mirror. I want to see myself in mirror. That means that I have not done something that was not good for the other people, or I have done something wrong, and so that everything I have done. And this is unfortunately during their all life, we meet so many people and we talk with so many people. And there are people, they believe in actual situation. When I am lying, I will be the winner. But they really receive the opposite. Because all people who say something which is not true, later they lose all credit what they have had in their life.
Exactly.
And this is for me the most important fact of my life, that I admire people when they honestly they tell whatever they think. And I have great respect to these people. But those people who have tried just to achieve something with manipulation and with, you know, with dirty actions, these people, they will lose in their life. That is what I say to all the young people. For example, my residents, my associate, they know when they say one word which is not true, then it's the end of story.
Yeah.
And that is what we have to teach every day to young people in the early age, when they are 25, 26, that we have to tell them that they should know how important it is. Sometimes they have, some of my assistants, they said, for example, the man has a pituitary adenoma, and it's clear. Or he said craniopharyngioma. Then I took him and said, look, if you don't know, say nothing. But if you say that it is a pituitary, it is not craniopharyngioma. They are very little things. I say as an example that the people who are educated with me or who are working with me, they know I have to be precise. I have to be absolutely clear. and say the truth.
Thank you, Professor Sami. Thank you very much.
Thank you.
Indeed, it's such a privilege to listen to again and so many times, of course, but every time it is very, very interesting and very, very wise and advice, which is always helps us in our life. Thank you very much.
Thank you very much. Dear Bastan, can you make a notice in your calendar 24th of January? 24th of January. You are in an activity which I have, you are included in that. Please, 24th of January.
Thank you, Professor. Thank you.
Thank you. Thank you, Majid. Thank you.
Thank you. Thank you very much.
Thank you, Miro. It was a pleasure to see you as always. And thank you, Dr. Banerjee. And it was also a pleasure for me to meet you. And I can say, just for this year, I wish you only a good health and enjoy the life.
Thank you.
Also.
Thank you. Same to you.
Thank you.
Same to you, Majid. Thank you so much.
Thank you.
So now we go on to the introduce, which it's not necessary, Professor Banerjee. Now, Professor Banerjee is someone who is actually represents what is called honesty. How can I tell you something? I'll start off with an anecdote, actually. Professor Sami knows, I don't know, Miro, whether he attended 1989 World Congress. Professor Banerjee organized the World Congress in 1989 in New Delhi. Very, very successful. And everywhere I have gone for the next 10 years, people remembered the type of receptions we had in 89 World Congress. So Professor Sami, of course, would know about it. I don't know, Miro, whether did you come there? I don't know. No, okay, you are young boy, maybe. All right, you are muted, Miro. You are muted. So next World Congress was in 1993 in Mexico, and Acapulco. I had been there. So Professor Banerjee was, of course, invited as a faculty there. And we had the trust, WFNS I Trust, which used to be managed by Professor Banerjee. And he used to help young neurosurgeons and from India and from South Asia for scholarship, traveling abroad, going for fellowships, helping them with financial aid and so on. And he was invited for Acapulco. I was a faculty at a public institution. I was not getting a lot of money, like many. I don't know whether Suresh had gone there, but Suresh also was that time academic institution with very, very meager salary in India that time. So we got support from WFNS I Trust by Professor Banerjee to help us attend Acapulco meeting, which I did. And he himself, who was deciding who will get the financial benefit, because he was also a professor in an academic institute and the money was not very big. And he did not go because he said, I don't have the financial, I don't want to take the financial help from WFNSI, India. And many of us went with support from WFNSI, Professor Sami, this you should know this, but he himself did not go. He backed out and helped us to go and attend that meeting. So that is Professor Banerjee to start off with. And I know, of course, many, many stories. This will not finish even in a day. But let me go and ask Suresh to start off interviewing Professor Banerjee. Suresh is a close friend of mine.
Thank you, Mr. for this opportunity. And I really consider it's a great honor because I was not a student of Professor Banerjee. Let me start first 1 minute. My early acquaintance with him. And, Professor Banerjee, during my residency days, I always, people have told he's a very tough taskmaster. So we were so scared of him. And part of the scare, I think, Mr. you later imbibed on us, saying that Professor Banerjee is tough. But my early acquaintance, first acquaintance with Professor Banerjee is he was called the subject expert for my faculty selection as lecturer at Trivandrum. And he had come and then I just fell into his trap. He asked which area you want to develop. And then I told vascular surgery. And then that time that patients with symptomatic intracranial atherosclerosis, who are high risk candidates for stroke. This ECIC bypass study just got over, and I said, I am interested in that. And then he said, what happened to the results of that study? And then that results had got published just about in New England Journal of Medicine, which I didn't know. And he floored me with so many questions. I don't know how he selected me. And that was my first acquaintance with him. And he would have realized what a useless fellow I have taken as a faculty for this institute. And then after that, we are very scared of Professor Banerjee, and only person whom we used to dread while presenting papers for national meeting, if Professor Banerjee is sitting in the audience, half of our courage will go. So he was tough, but he was very kind at heart, which we never knew. So like that, it went on till the year 2001. I think that time, for the first time, Professor Banerjee, Professor Tandon, we were in a car together while getting dropped to the airport or getting picked from the airport. This was Professor Ramamurthy's 80th birthday. And then that time he was asking, how are you, Suresh? How is Trivandrum? Like that. By the time I was heading the department there. And then also, Professor Banerjee we used to never cross paths because I thought I should avoid this. Professor Banerjee is such a big man. And the real opportunity, the real Professor Banerjee, I came to know in 2004. There was a meeting in Australia, which is a skull-based meeting. This was in 2004, World Skull-Based Congress in Sydney. And so we were at a meeting in Jaipur. When I was just walking in front of him, he said, Suresh, are you going to Sydney? I said, sir, I am not going. I don't have any funds to go. He said, you are going, you are coming with me, you are staying with me. And that was the first real experience I had of Professor Banerjee. What a man. We stayed in the same room. And after that, it was all, our friendship exponentially grew. And that was my initial beginning with acquaintance with Professor Banerjee. Now, let me ask you some questions, Professor Banerjee, very simple ones for those people who have not read many of the writings. Why did you choose to come to All India Institute when you had a position, full-fledged department at Bangalore? Now the present Nimmans, you were offered a job there. Why did you choose to come to Delhi? I know you are not from Delhi, you are from Lucknow. But why did you come to, and you were also offered a faculty position at Vellore. Why did you go and choose All India Institute at Delhi?
Well, firstly, let me thank Basant and the organizers for calling me. And let me thank Professor Sami for the wonderful interview which he did. And it's a very hard act to now follow him. Now, the question that you have asked me, why did I choose Delhi, AIIMS? The fact is that truly there were very few centers which were already established. And of course, Bangalore was one of those centers which was already established, and one knew that it would head forward to greater things, which it did. But we also knew that AIIMS had nothing. It was a very grave challenge, and challenges have always sort of attracted me to start something from scratch. And actually, when I say scratch, it was actually from scratch because there was nothing, not even an office, what to say of a bed and what to say of an operation theater. So the challenge of starting something. Secondly, of course, my wife had already found a work there. So that also was the other reason. So, one thing or the other, all things. And then, of course, fate, which brought me to All India Institute.
Okay, sir. My next question is, what was your connection with the powers at Delhi that time? I know R.K. Dhawan, who was principal secretary to the Prime Minister, you were close to him. You were also close through him to the then Prime Minister of India, Indira Gandhi and all. Did that help you very much?
No. In getting in AIMS, no, not at all.
To establish the department, sir. To establish the department.
My, see, you must remember, those were different days. Today, everything is different. We are relatively more or better economic-wise. It is much easier to fund things today than it was then. So one had to decide to keep the people on the right side to get funds to develop the department. And whatever it was, I mean, whatever it required, it had to be done to do that. And of course, one did as the circumstances required.
Okay, sir. In my next question, sir, Professor Vimala Virmani, who also spent quite some time at our institute at Trivandrum, I understand that she was your counterpart neurology professor at AIMS that time. And I had read that, what was your relationship with her? It's a love-hate relationship or love or hate, because what I read that, your strategy to get things done with her help is to tell exactly opposite of what she wanted. And then she used to agree for that. So what was that trick, sir? That I read, I really loved that sentence which you wrote.
No, that is, I think, sort of digging things below the ground to find out all the bad things I did. Yes, I think, as I told you, that it has been long one of my habits to first decide what my aim should be. And once the aim is clear in my mind, then I would use any means to ensure that the aim is fulfilled. Okay, and it would work in different ways with different people. And with Dr. Virmani, she is no more, and she was a very good friend also. In matters of development, etc. I found that this worked.
Yeah, okay, sir. Very nice. And sir, let me ask you one phrase I will quote from Charles Dickens' Tale of Two Cities. It's just like that, what were your best times and worst times at AIMS? So that novel opens with, it was the best of times, it was the worst of times, it was the age of wisdom, it was the age of foolishness. Just to compare the opposing opportunities and the situation in England, across the English Channel, in France and in England. So what was your worst time and best time or why your tenure at All India Institute of Medical Sciences? Which you can tell, okay, and this was pretty bad.
Which, let's say, the best times, I think the entire period, which was roughly about 3 decades of the most productive and fascinating part of my life was spent there. And I think I had a fantastic time. As I look back, it is easier to answer the question at that moment of time, whether I felt better then or later on. No, I don't think so. I had a wonderful time. There were some storms. There were mild excess rainfall sometimes. Yeah, I mean, that will happen in life. You can't choose the environment in which you are. But nevertheless, I think by and large, I had a good life. And I'm very grateful to All India Institute of Medical Sciences for that.
Okay, sir. Now, of course, I know, sir, Professor Mehta and Professor Mishra, they were your outstanding products of the Institute. But my question is, who you consider as the most innovative resident during their residency days? You would have so many people you would have.
No, I certainly, that is a little tough question to answer, because there are many traits in many people who trained with us who were outstanding.
Yeah.
And so I think, let's say that there were so many of them who were excellent, superb. Vasant, of course, Dr. Mehta,
that's the below the belt question that he cannot answer.
Yeah, that's what I'm saying. That it is an unfair sort of a question to ask.
I am withdrawing that question. Okay, sir. My next question, sir. After leaving All India Institute, you just went for private practice to BIMANS and later to Apollo Hospital. What was the big difference you found in these two setups? You were all through a hardcore teacher, now going from there to a private institute. What difference did you find?
Tremendous. As far as the teaching is concerned, in a public institution, it is far easier to develop modules of teaching, to experiment with one or the other methods of, shall I say, learning rather than saying teaching. And this required, number one, people who were willing to be, good students or good learners. And it is much easier. And in public institution, you would have a large body of people from whom you select very few of them. So obviously, you would have a large talent pool in a public institution, which is not there in any private center. The second thing, of course, is the numbers are so few in a private center that you cannot give individual attention, because the same person has to be, the dishwasher and the bottle opener and also the storekeeper. So he or she is stressed all the time. But nevertheless, one was able to train several young people who have done well in life and who are doing very well in life, shall I say. But one of the major things which happens is that in a public institution, hands-on experience is possible. In private practice, that is more or less impossible because particularly the litigious public which is there and various other reasons, it is virtually impossible to do so. Now, of course, things are a little better in the sense that we have skills laboratories at various places, including at All India Institute of Medical Sciences. Cadaver workshops are being held all over India, and All India Institute also has a very good cadaver lab. So this is possible now to simulate surgical skills, which started only in the last, let's say, 10 years or so, and they are doing very well. I mean, consider when Basant was there decades back, we had this one table in my office and a table microscope, and Basant used to learn himself.
I wanted to tell.
Right.
I will tell something about this now. Though the labs have become much better, this started when 1981, I think 79 actually, to be precise. It started by Professor Banerjee, the microsurgical training, and Professor Sami is one of those early or once teachers who had come, and this was facilitated by Professor Banerjee. And many renowned neurosurgeons would come and teach and demonstrate, like Professor Sami. And we were that time there were very few neurosurgeons. Trainees were very few, and the load volume was very, very high, especially in All India Institute. And I remember that time during my residency, we were 4, out of which one has to go for a rotation to other institute sometimes. And unfortunately, the fourth, another one fell sick. So we were 2 people round the clock, 7 days a week on duty. And so just to tell Professor Banerjee, not only neurosurgery he taught us, he got us in the duty room, he got a shaving blade, and he said, you should shave before coming to the ward. So we had in the duty room of the ward, he arranged for us for shaving cream and shaving blade so that we shave and look presentable to the patient. That is Professor Banerjee. But more importantly, the lab which he started, we used to curse him. I used to curse him then because every third day when we had people, he used to say, you have to go and do this rat carotid and rat peripheral nerve anastomosis. You should learn in the lab, which used to do it. And of course, we were tired and we said, oh my God, who is going to do that? But I'll tell you, I must have done about maybe 70 rats during my training in residency training. And then I went to UK, Edinburgh, and I was part of a research program there. And of course, many people go to that time. UK was a good destination for Indians. It was easy to go there. And there were people from different institutes were going there. Many of them had never seen a microscope. And here I was, who had done 70 odd carotid anastomosis in the rat. So I was in a project. I was the first year I went there. And my senior registrar explained to me how to do it. And, he said, you will kill about 5-7 rats before you get a hang of it. BK, he used to call me BK, don't worry about it. I said, fine. And he explained to me that we are doing a blood flow measurements in the rat after putting a sham carotid ligation. So he left me with the explanation and went back and came back about an hour. I had finished the carotid anastomosis. He said, what did you do? I told you that you have to take I was doing a blood flow measurement, actually, electrode in the rat brain. He said, we have to first do an anastomosis. I said, I have done that. And he was obviously shocked that I could do it. And that was because of Professor Banerjee having forced us to learn microsurgery. And from that day, in the department, from first year, I became the 6th year neurosurgery resident. Professor called me. Professor Miller was the guy under whom I was training. And he said, you give me your logbook. And I was just promoted from first year to 6th year. So that was Professor Banerjee, a very tough taskmaster. 7 days a week we had training. Sunday we used to have a grand round on Sunday, and all of us have to be there. So that is what Professor Banerjee was all about. And of course, like Professor Sami said, all of us are residents. We were many times we had, not once, many times we had gone to his house, had dinner, had a drink. Mrs. Banerjee was a very gracious and a very lovely host, and we had lovely time, which I still treasure. And like Professor Sami said, the mentor, the student becomes like his mentor, talks like his mentor. Many of my colleagues have told me that you were talking like Professor Banerjee. They say this does happen, and it is true. There's no question about it. Suresh, go ahead.
Yeah. Now, my last question to Professor Banerjee. He is a very strong proponent of integrated neurosurgery residency program. For Professor Same and Professor Butik, this is, in India, we have 2 types of residency program in neurosurgery. One is after your bachelor's in medicine, one can do a 6-year program. And other is after bachelor's in medicine, you have to do 3 years in general surgery and then do a 3-year program. Professor Banerjee himself he has done a program after general surgery, but later he became a strong proponent of the integrated program. Why, sir? Can you just tell why you thought the integrated program is better than that 6-year program is better than a 3-year program after MS?
You see, one has to go back in time. It's easier to say what I want now or what I think is the demand of the times now. See, those were days when there were very few neurosurgical places where a person can get, after training, a placement. So I think it was an uphill task. You train yourself, and then to look for a place where to work was quite a difficult task, the least to say. So at that time, the only people who would be willing to come, and believe me, in the beginning, nobody would come. Sometimes there would be nobody who would be willing to come for neurosurgical training after doing the surgical training and obtaining a degree that used to be called MS. So it was thought by the founders like Jacob Chandy and Ramamurthy that let us begin with having people who have done their MS surgery, let them train, and then suppose it doesn't work, they can always go back to doing general surgery, or they can combine general surgery with neurosurgery till they are able to get a foothold in neurosurgery. So those were the demands of the time. You know, we have to go back in history. The first neurosurgical 2-year course person passed out in 1961. So that was a long time back. Now, it was not because that was the question of choice. Then it was found that there is a large amount of work to be done. Neurosurgery has expanded exponentially. It is not the neurosurgery in which we trained, or our earlier people were trained. Now, microsurgery, spine in its own thing, peripheral nerve surgery, endoscopy, stereotactic radiosurgery, epilepsy surgery, vascular surgery, you name it, skull-based, etc., etc. That's a vast expansion. People's expectations are very high. So people want a person who is trained. As I told you earlier, it's a litigious society. The whole society has changed. It's looking for, like the American society, looking for faults in the system, faults by the surgeon. So in this situation, we require large amount of time. Now, if you have to spend time in doing your MS surgery training, appearing for an exam, and then again going for a long training, is impossible. Secondly, I strongly believe that in neurosurgery, when you come from general surgery stream, you have to unlearn things, unlearn skills, and so on, because this is a different world altogether. And the way it is to be done is totally different. So I think it is important that we should have openings for a person who has just graduated and become a doctor to join the stream of training in neurosurgery, which I think it should be a minimum of 6 years from the time that you start. And for example, right now, the things that we already have, we have 6-year courses in several centers, including your old center at Suchitra. You know, there is this, we need to fine tune it. We need to sort of replace the methodology which we are using and get newer methodologies, newer methods of pedagogy, skills, etc., so that the world becomes you train the person who is the final output, and that is what a teacher is supposed to do, will be worthy of the training that the person has had. So that's it. I am very strongly in favor of it.
My last question, sir, your late wife was a big inspiration for you. So can you just tell us what is the role of spouse for the neurosurgeon?
Tremendous. I think because it's very, if you have a spouse who is not supportive, neurosurgery is impossible. I think many years back, I had been told a story by a colleague of mine who was training in USA, that they usually around Christmas, all the senior consultants would have a party of residents. That is the time when they opened their houses. And so had happened with, I won't name the place or the person. And in this party, there was this young resident who had joined a year or two back, and he had gone with his young spouse who got tipsy with a little bit of alcoholic beverage. And she started to ask the chief, as they called the senior consultant in USA, that what have you done to my husband? So he was quite stunned. He didn't know what to answer. I said, what have I done? Do you know that night after night he doesn't come? And then when he comes, the damn fellow has become impotent. And so I think neurosurgery residency is pretty hard. And without an understanding spouse, I think it is very, very difficult. You know, the times when I remember having to come back from a social function, and including once when the occasional movie that we went to, suddenly the slide came, Dr. Banerjee is required to come immediately. And we had to go back, of course, because there was something very, very urgent which had happened. So I think that's it. But on the other hand, yes, life has been nice. You know, I mean, this question was asked to my wife in some place where we had gone, in some gathering. And she said, now that I'm older, I think it was nice. If he would have been there all the time, we would have started to fight all the time. And it is better that he would come once in a while, and he would be a much loving spouse. So that's it, Suresh.
Thank you very much for answering all my questions. Back to Basant Mishra.
Yeah. There is this the sentiments which is expressed both for Professor Samy and Professor Banerjee. I will read that from Professor Mathuria. Professor Mathuria was the chief of one of our very premier institutes in India, postgraduate institute in PGI in Chandigarh. He was the professor and chair of neurosurgery. Now he's retired and gone to a private sector. And he's visited you in 2000. He writes, which I share, and I cannot agree more, is Professor Samy identify the facial nerve before any monitoring. And he always is right. So, and of course, and many of us, he writes that were taught by him and we follow his principles. So I share that absolutely. So that I just wanted to read it out. And he talks about Professor Banerjee, which is absolutely 100% correct. And I agree, I would have started with that, but he has put it very nicely. He is the father of microneurosurgery in India, no question about it. He started the training of microneurosurgery. We were the first generation of residents who trained in microscope, and that's because of thanks to Professor Banerjee. He also was instrumental in developing cerebrovascular surgery in India. He happens to be the first president when we started the society. I was the secretary, and he was the first president of Cerebrovascular Society of India. So his contribution to skull-based cerebrovascular surgery and microneurosurgery as a whole cannot be told in words. There's no question. He is considered the father of microneurosurgery in India. But much more than that, he was, as Suresh said, he is a very tough taskmaster. When you start off your neurosurgery, you are very scared. But when you end up your neurosurgery training, he becomes the most lovable character in your life. And he remains a lifelong mentor, friend, advisor, elder brother, and so on. And till now, it's been 1980 I joined. So it's 40 years and more than that now. I still have memories of many incidents which I cannot share because of sort of time. But thank you very much, Professor Samy and Professor Banerjee, for having agreed to be here. It's such a pleasure. And Professor Samy, obviously, I'm sorry that you had to spend so much of time here. Your patients may be waiting there. He just said that he just came back. Which surgery, by the way, what did you operate before you came here? Acoustic, you are muted.
Muted.
So now you can hear me.
Yes.
Today I had spine surgeries too. One was spinal canal stenosis, L3-4, L4-5. And the other one was cervical spine, a technique which I have developed in the late 60s. And I think I am so disappointed that still this technique people have not learned around the world. And that is the anterior approach to the osteophyte extension of the vertebral body, with narrowing of spinal canal and narrowing of the foramina intervertebralia. You know, all these foramen are closed and the patient is suffering. Believe me, these patients I operate, they are completely destroyed. They have pain, but the pain, and they had completely paralysis from deltoideus and biceps, triceps, and also hands, and mostly they are between C4 to C7, and at that time, as I started microsurgery, because I don't know if you remember Professor Cloward from Hawaii. He was in 65 or so, 66 in Mainz, spent 2 weeks with us. And I was at that time the resident that I had to assist him. He operated without microscope and so, but the Cloward technique, he had a instrument that make the hole.
Cloward set.
And then remove the disc, and that was all. And then took from the pelvis, they took them one bone and put them inside. That is what the first experience of mine about the cervical. And in the back was similar. And I have observed, that was one of my first discovery in neurosurgery, that all these patients that we operate here, remove the disc, after surgery, they have still problems. They have still the same neurological deficit. And I have tried to do, because we had at that time, you know, that I introduced in the plum encephalotomography. This is my dissertation, become professor, associate professor in Mainz. And there was nobody did this technique at that time. I tried to give the error and then make 1 millimeter slices. I could create pictures at that time like the MRI today. You know, at that time was not CT scan, was not MRI, nothing, not at all. But at that time, then I made these slices by these patients with the cervical osteophyte and osteochondrosis, and I found that the foramen are closed and the root is inside. And I did it before surgery and after surgery. I saw it's the same, nothing has changed. But I said at that time, the technique which I used in 68, I did the first microsurgery of acoustic. And I have started to learn how to open the internal auditory canal. Before that time, nobody opened the internal auditory canal. I remember that our friend Atul sometimes said, there is no need. You remember in the meeting, I killed him. I said, come on. And nobody tried to open the internal auditory canal. And I have learned that the tumor extent there, without it's impossible. Then I said, why I should not do the same in this cervical? So that I started to use the microscope diamond drill, which at that time was also existing. It is not new, the diamond drill, it's from that time. And then try to extend the exposure laterally as far as to receive the root, and the root is open. This technique, I started 68, 1.5 years, my heart was always pulsating. I was so afraid because I was anxious about the nerves and vertebral arteries. Finally, after 1.5 years, I had 2 discoveries. before me, nobody has done this surgery before me. I said, first of all, I could decompress the nerves. And then the second question was, do we need to make a cage or something inside or not? I have studied about 10 cases without, and then I saw they are not good. They can move and then create clinical symptom. So that then I started to put then a bone inside, and later I used them. We had no cage. I used it as an acrylic, as a palacos, is a methyl acrylic substance, you know, that
yeah.
used for the covering the bone. And then I put that, it was working. But important, what I discovered was the main complication from the ventral approach was the post-operative bleeding or trauma to the spinal cord. And I have learned at that time already, I can preserve almost in every case the ligaments. If you preserve the ligament, you can with diamond drill bring every osteophyte out. Sometimes, of course, when this is ruptured, you have only a hole and you can take it out, but you can preserve the ligaments. When you preserve the ligaments and you open the both roots, and then you put a cage, today we have a fantastic cages, then put it inside, the patient is free of symptoms, is newborn. And today this patient had 3 levels, and I had to go to all 6 nerves and remove it, decompress it, and the 3 5mm cages I have put. And in this case, I put then a plate and then with a screw, because when you do the 3 cases, you have to have a stability. That was one of my surgery today.
I think you are not talking about this. I think next one of the courses we'll have this talk about spine surgery. You've been not talking about spine surgery. I think we should have that one in one of our courses next time, sometime.
What I have not done, I had so many topics. I have excluded to give lectures on spine, but a spinal tumor, yes. I have published a book of 1,000 spinal tumors. I have published many years ago. But I have not done, but believe me, from C1 to sacrum, in all area, I have, believe me, I have tried to make it as fine as possible, as of the security for the patient. The other thing which I have not published so many is the aneurysm. I have clipped thousands of aneurysms in my life, but I never found any discovery in aneurysm. Because what is the aneurysm surgery? You find the main vessel, you come to the neck, and either from right side or left side or whatever, you clip it, you know. But my idea was how I can change the aneurysm surgery. I said, aneurysm surgery is already discovered. Expose it with a nice way and clip it. Everything. The only thing that at that time I said before Sugita's clip came to the people, but they didn't understand me before Sugita's clip. I said, we need a clip holder which at the end is possible in any direction to change the direction in order to go. That was, I said that would be some innovation for aneurysm. Everything else, when we are honest, nothing has been changed in the last 50 years. The only thing what has changed is the interventional technique, which I have supported a lot, but still there are many cases they need clipping. Believe me, I can close my eye, I can any aneurysm clip that without any flow. This is my.
Thank you very much. I think we should end on this positive note that so many things are still required to do. Thank you, Professor Sami. Thank you, Professor Banerjee. Thank you, Miro, for interviewing. Very nice interview, and Suresh for doing this a tremendous job. Thank you, everybody. And this will be on YouTube. I will send you the recordings in due course. Thank you very much.
Thank you so much.
Thank you. Thank you.
Goodbye.
Thank you,
God
everybody.
bless.
Professor Sami, Professor, you kick everybody.
Bye-bye.
Bye.
Everybody, goodbye.
Bye.
Yeah, just to say, introduce our my young colleague Abhijit Warade, who actually is doing the organ. He is in the picture there. Abhijit is our young consultant who has just become the new consultant in my department from 1st January. He's trained with us about 12 years back, and he has had multiple fellowships, and now he has joined as a consultant. So he's actually helping me to do this. Thank you very much, Abhijit.
Thank you.
Bye-bye.
Thank you.
Thank you.
Bye,
Thank
everybody.
you.
Have a
Bye.
great career, Abhijit. Bye.
Bye.